Hello, everyone. I'm Rachel Jean-Baptiste, professor of history at UC Davis and the faculty director of a center called IDEA, the Institute for Development, Equity, and Advancement, and it's located in the Office of Diversity, Equity, and Inclusion. So what we do at IDEA is we support programs and interventions that reduce barriers to and allow access to everyone, regardless of various life factors, to educational opportunities so that every human being has the potential to reach their full potential. And as we now approach year two, what is halfway through year two of this global pandemic that has led to tremendous loss of life, livelihood, and for our most vulnerable and precious resources, our children, also everything that they hold dear and normal, and that is for our focus today of school. And so what the Office of DEI has done is we partnered with a project called Healthy Davis Together that is now Healthy YOLO Together, in terms of thinking about how the Davis community and the broader region and community that we're in, we can help stop the spread of COVID and also mitigate its economic barriers. So we started this series called Parenting During the Pandemic, and we had a session with Dr. Dean Blumberg and Dr. Lena Vanderlist, who are affectionately like for us to call them Dr. Dean and Dr. Lena, to prevent the most current, up-to-date, research-driven, science-driven data so that you can make the best choices to keep your kids safe as we enter into this school year. So you've read their bios. I can tell you what their titles are, but I can just tell you that Dr. Dean is the professor and the chief of pediatric infectious diseases, and Dr. Lena is a general pediatrician, and they also hold a podcast. So they're going to do a 20-minute presentation to catch us up to speed, because the last time we talked, the Delta variant was not such a huge factor, to give you information about the Delta variant, vaccines, guidelines for keeping kids safe, but most of all, we're going to get to your questions and answers. So some of you have already posted questions prior. You can also post more questions in the Q&A, and we will get to answering the questions to the best of the ability. So again, you feel like your kids are safe and confident with whatever choices you make with them with this academic year. So Dr. Dean and Dr. Lena.
Thank you.
Yeah, thanks so much for having us. We are excited to give you guys, the listeners, the opportunities to ask your questions today. And really, that's what the main focus of our discussion is going to be.
Mm-hmm. So we're going to first start off and talk about the Delta variant and how that's led to more breakthrough infections, and then talk about the back to school algorithms and the vaccine updates with the FDA approval, and people have heard in the news the boosters, and then the timeline for getting vaccine available for kids who are even younger. So first, we're going to talk about the Delta variant.
Mm-hmm. So, of course, we were all starting to see some resemblance of normalcy come back. Maybe you weren't wearing your mask in the grocery store after you'd been vaccinated. And then bam, we started to see these increased numbers. Of course, we know that the Delta variant originated in India, and there we were seeing really devastating consequences of it there. And then unfortunately made its way here. It's now the predominant circulating strain in the US and definitely here in California. And unfortunately, we are seeing that its increased transmissibility is really seeming to affect kids more as well as adults. And so a lot of parents are coming into my office and asking, what's the risk? How many kids are hospitalized? How many kids are getting this? And so just, anecdotally, I have seen many more kids test positive in my office during this wave than during even the wave back in December, January of last year. And I think that just has to do with the fact that so many kids are still unvaccinated, and it is just much more transmissible. Dr. Dean, I think when we think about like the R naught, or how many people can be affected by Delta, I read that Delta is somewhere between like 6 and 7 versus the Alpha, the regular, was about 2. So what does that mean again exactly?
Yeah, so that's how many people an infected person will transmit to. So you can see that it's 2 to 3 times more infectious than the previous strains, and it accounts now for 98% of the circulating strains in California.
Yeah. And so, like I said, we are seeing this more in kids. This data was pulled just from a little over a week ago from the Children's Hospital Association, and it showed more than 180,000 new pediatric cases of COVID-19. And this was a fourfold increase in cases from the end of July. So a real significant increase. The percentage of total cases that kids make up is increasing as we vaccinate adults and are not able to vaccinate children yet. So it was about 22% of all new cases. And among states that did report hospitalization rates for everyone with COVID, so not just children, it ranged somewhere between 1.6 and 3.6 of the total cases of hospitalizations for COVID-19.
And just to give you an idea of what's going on in the US now with children, you can see this graph that shows the number of cases admitted to the hospital over time. This was our winter surge that we had. And you can see for children, it's even worse now. This is the worst it's ever been in terms of children being admitted to the hospital. This was presented today at a CDC meeting, the Advisory Committee for Immunization Practices. And they also mentioned that for hospitalized 16 to 17-year-olds, that 25% of those hospitalizations end up in the intensive care unit, that more than 5% end up on a ventilator. They need mechanical ventilation, and 0.7% die in the hospital. So although COVID is less severe in children than compared to adults, it can be quite severe, and thousands of children being hospitalized and hundreds of children have died in the US from COVID.
So that leads us to back to school. You guys are probably like, oh my gosh, well, that didn't start off very well. And here I am sending my kid to school every day, and really putting your trust in others, right? That they're going to be doing the right thing to keep their kids home from school when they're not feeling well, especially if your child is not 12 years or older and hasn't had the opportunity to get vaccinated. So we definitely don't want you guys to take that as like a whole doom and gloom. I do think that there is a way that kids can stay in school safely. Thankfully, we live here in California where universal masking is being done, and that is going to be our biggest barrier for kids to all wear their masks in classes. But definitely for me as an outpatient pediatrician, this has been a very interesting experience navigating the back to school process as you all start sending your kids back. And I have been relying on pretty heavily these decision trees that I'm sure you as parents have received from your school, and they may look a little bit different than this, but most schools are using something relatively similar. So we can kind of walk through this together, and I can try and address some of the questions that frequently come up for me when I am talking to parents on the phone or meeting with parents. So you can see here, this is first the decision tree that looks at a kid with symptoms. So commonly, right, you're going to have a little bit of runny nose, a little headache, like with the smoke right now. Maybe your kid has coughed a little bit more than usual. And so we are all trying to do the right thing and make sure that that's all it is. It's just the smoke. It's not COVID. So if your child has any symptoms, either you yourself will pull them out of school, or they're going to be sent home at the first sign of a little cough that their teacher hears in the back of the room. And you are going to either say like, no way, I know my kid has asthma, they do not have a fever, this is like exactly their symptom, and you'll call your pediatrician, and maybe they'll write you a note that says, yes, this is how this child presents. We know that, and maybe you'll be able to go back to school as long as they've been 24 hours without a fever, so less than 100.4, and their symptoms are improving. And this is where camp I'm falling into, well, let's just test them just to be on the safe side. So many pediatricians will order a test for COVID, and then you can see here if it's negative, same thing. If it's positive, then we're going to have to isolate at home for 10 days, and make sure no fever for 24 hours and symptoms are improving. And then they'll move on to contact trace any other students or individuals that your child may have been exposed to. So we can go to the next slide. So I will stick a little bit more towards the like your child was exposed to a positive person at school, and less outside of school or in the home setting, because if it is in the home setting, it's considered an ongoing exposure. And so they really want those kids to be out for the full 10 days, if not longer, if they develop symptoms. So let's say that your student comes into a positive COVID exposure at school. And I'm sure many of you have already gotten that email, because pretty much every parent I've talked to that has kids that are in school have gotten some email that's either like, oh, FYI, there's somebody in their school or their class, but they don't sit at the same table. Or you may have gotten that was like, this was considered a direct exposure. And there's kind of two different decision trees based on that. So if they were within 6 feet of the person for 15 minutes or longer, then that is considered an exposure. It actually doesn't matter as much if they were wearing masks or not as it used to, but we'll go into a little bit of the details below here. Your person is most likely going to be a student, and then is the person vaccinated? So in all of our kids age 12 and up, having a vaccinated individual or child is going to really save them some struggles with this. So again, I mean, for so many reasons, which we talked about last time, we'll continue to talk about, getting vaccinated if you're eligible is so important. So if they are vaccinated and they are asymptomatic, then they can go back. If you would feel more comfortable having a COVID test, then that is recommended and reasonable, but not required. If they are symptomatic, then they need to isolate and test for COVID, and they're not eligible for a modified quarantine. If they are not vaccinated and both were wearing their masks appropriately, then they are qualifying for this, what they call modified quarantine, where they can continue in-person learning if they test a couple times a week after the exposure, and they're not like blowing their trumpet at band practice or like going to sports practice or any of that stuff. And so usually most schools are providing this testing, and it may be what's called like an antigen or rapid test. And I know a lot of parents are coming to me and saying, you know, they're having my student, my like 8-year-old self swab for the rapid test. Like, is this accurate? Is the antigen test not as good as the molecular test? And so Dr. Dean, I would love to hear your thoughts about this, but for my experience, the antigen test, which is the rapid test, or the ones you can buy at CVS, the ones that a lot of the schools are doing, are pretty good for symptomatic infections. And, you know, again, with Delta, with the higher viral load that a lot of people carry from Delta, it may actually be better for asymptomatic infections as well. But it is not as great as the molecular test. So if your child has symptoms, which would kind of shoot them over into the not eligible for this, then it can be good. But what you may want to consider doing is at least getting one molecular test from your pediatrician on at least day 5 or after, because that is going to be the most likely to give you a true result. So you can see this at the end, that you can continue that modified quarantine testing with either the antigen test or the molecular test, and they can end quarantine after day 7 if they have a negative test collected after day 5, because that's going to be the most accurate. Dean, do you have any thoughts on that?
Yeah, I mean, any test is okay, but yeah, the molecular tests are certainly preferred.
I'm having you go in and out, but I'm not sure if everybody else is.
Okay, I'll change.
Okay. I wasn't, if one of the other panelists could put in the chat if they're having trouble hearing Dr. Dean, I just want to make sure.
Dr. Blumberg, your audio is fine on us here.
Oh, okay. Well, then I'll keep this microphone. Yeah, any of those tests are okay. The molecular tests are more sensitive. And so those are better tests if somebody's symptomatic, because we would hate to miss somebody. We'd hate to miss that diagnosis if somebody was really and truly infected, we would hate to have a false negative on that. And so that's why for symptomatic individuals, it's more important to use the more sensitive tests, including which are the PCR assays rather than the antigen tests.
Yeah, and I will say that in my experience so far, when the antigen test has been positive and we've repeated the PCR in the office, it has also been positive. So I haven't seen that where it's like a false positive. I think probably more we would have false negatives. Is that true, Dean?
Yeah, that's true.
Yeah. Okay. And then the last decision tree over here is if they're exposed outside of school. And I will send all of these links, which I hope that you already have them if you have a child in school, but I will share them so that you also have access to this.
I wanted to go through a study that the CDC released recently, just last week, about schools. We know that we can go back to school safely when we do have the appropriate mitigating factors in place. So many people might have seen this in the news. This is a experience in Los Angeles County, and what they compared was children who were distance learning versus those that were exclusively remote learning, and others in the community. And schools that provided in-person instruction were required by LA County health officer orders to implement prevention measures such as symptom screening, masking, physical distancing, cohorting, and contact tracing. And so it's a little bit of a crowded graph here, but just to show you, the dark blue line is all children and adolescents in the county of LA. Students who are doing in-person is the light blue portion of the bar, and then the adults, all adults are in the black portion of the bar, and then the grays are staff members who are working in schools. And what you can see, first looking at children, is over time, you can see that the rates of COVID that were occurring in children who were attending in-person school were actually lower than community rates, than children in the community, showing that school was a very safe environment to be in. And also staff members working in school had lower rates than all adults in the community in general. And so I think what this shows is that if you do have these appropriate policies in place, that schools can be a very safe place to be. Now, the one caveat I'd add to this is that this was all pre-Delta. Delta first really started in mid-June to July, being the predominant strain in our communities. But we still think that this will apply as children return to school now, even with Delta being the main variant that's circulating in the community. I wanted to talk about additional doses that people may have heard in the news. One is that for immunocompromised individuals, those with significantly weakened immune systems, there's a recommendation that's already being implemented for a 3-dose series. And so this isn't really a booster dose, it's giving a 3rd dose after the 2nd dose as part of the primary series for people with weakened immune system. The issue is that if people have significantly weakened immune systems from cancer or chemotherapy or primary immunodeficiencies, that only about half of them will respond to the vaccine series. Giving that 3rd dose means that about 1/3 to half of those who don't respond then will have more response to the vaccine and have better protection. And then the second issue that people may have heard in the news is giving a 3rd dose as a booster dose to those who've been vaccinated. And initially the recommendation from the announcement from the White House and from the director of the CDC was that that booster dose would be 6 or 8 months after the original dose, after the original series was complete. Yesterday, there was something in the news about 5 months. These are all unofficial recommendations, though. It's still unclear how long the vaccine series works. And the CDC did have a meeting today, which they did not have any conclusions. So it's anticipated that sometime next month, they might have recommendation for booster doses. It's likely that the initial booster doses will be recommended for healthcare workers and for the highest risk individuals, which won't be kids. These will be residents of long-term care facilities and those 75 years of age and older. So in terms of getting booster doses for the rest of us and for children, that's going to be a little bit farther off.
So let me know if you guys are having trouble hearing me because I'm having some connection issues over here, but I will try to go through this. So I just wanted to touch briefly on pregnancy because I assume a lot of you are younger parents, maybe considering having more children, or may know someone who is pregnant and or breastfeeding and maybe worried. So one interesting statistic is that really only a quarter of pregnant women are vaccinated. And this is a little near and dear to my heart right now because you guys may be hard to miss these days, but I will be having a child in 7 months. So I was so thrilled to be able to protect her with the vaccination before getting pregnant. And I'm looking forward to my booster dose. But we can go to the next slide, Dean. We are seeing that COVID-19, but especially the Delta variant, is really, really sickening, unfortunately, pregnant women more than women in the general population. And so there have been some studies looking at this and showed that 15 pregnant women are 15 times more likely to die from COVID than from women who have COVID who are not pregnant, 14 times more likely to need a breathing tube, and then really 22 times more likely to have a preterm delivery. And so that obviously matters for us as pediatricians because preterm babies have a lot of other risk factors and concerns for development. So it's so important to protect yourself during this period. We are seeing at UC Davis more pregnant women admitted and severely ill. And so I just want to reiterate that there have been many studies now looking at the vaccine in pregnancy. Over 150,000 women were looked at in the CDC vaccine repertoire, where we all signed up when we got the vaccine initially, and it showed no harmful side effects of the vaccine while pregnant, and that included under 20 weeks. So it is very safe to get, and ACOG, which is the American College of Obstetricians and Gynecologists, have put out their formal recommendation that all women should get it. And as pediatricians, we know that antibodies also pass in the breast milk. And so you should continue to breastfeed your kid for as long as possible. And if you're breastfeeding, you should also get the vaccine.
So in terms of the timeline for vaccinating younger children, we do have vaccine available for 12 and up. There are studies that are ongoing for 5 to 11 years of age. They're using a different dose of the vaccine and doing extensive safety follow-up. We anticipate that there will be submission to the FDA first for emergency use authorization, probably in December is what we expect. And the turnaround time from the submission to getting that authorization has generally been about a month or less. So maybe for those younger children might have vaccine available in December or January. And then for the younger ages, for those less than 5 years of age, we anticipate that those studies will be completed and maybe the vaccine will be available for them sometime next year.
One thing I love is parents who are as excited about getting vaccines as I am. But because of that, I've had a lot of parents reach out after the full FDA approval of the vaccine and say, are you considering giving this off-label? And for example, my 10-year-old is really big. He's like the size of a 12-year-old. So can you just give it to him? And I completely understand where you're coming from. Probably does a 10-year-old that weighs as much as a 12-year-old just because we have their weight doesn't mean that we base vaccines on weight. We base our vaccines on how our immune systems respond. And so the AAP has come out, the American Academy of Pediatrics has come out and pretty much taken a strong stance that we should not be giving any off-label uses of these vaccines. We really want to study them rigorously like we did in the other age groups and make sure we have the appropriate dose, the appropriate immune response. And so hopefully just a little bit longer, but be patient with us. Of course, still, you guys, I hope all know now how to schedule your vaccine, but myturn.gov is still available for you. Like we mentioned before, there's a special vaccine clinic that's held at the Mind Institute for those who have neurodevelopmental differences. And, really all of our community clinics here at UC Davis, we're offering the vaccine daily. So should be easy to get in and get an appointment. And we really just want to turn it over to you guys, all of the participants, to get your specific questions answered. Thank you all for submitting some before the webinar, but we will turn it over and answer your questions.
Great. So we've got questions that are broadly in a couple of categories. So one is testing, second is vaccines, masking, exposure, and then what I call settings, which are space and activities. And then also, my child is tested positive for COVID. What do I do? So let's start with the question about masks, just a really clear question. Oh, before we get to that, actually, I should just say there's a survey, there's a poll that you all are seeing. And part of the reason why you're seeing this poll is because we're trying to address disparities. As we know, science is not objective. So if you could please take just a few seconds to answer these questions so that we can see who's coming to this survey and also just how we can better address needs. So thank you so much. And again, this is an interest of making sure that it's equitable. So our first question has to do with the question of masking. And maybe we have another maybe 20 something or so seconds while people can answer the poll. So let me just pause to make sure that each of you get a chance to do so. Just 3 more seconds. Thank you. Thank you so much for, again, answering this poll that's just giving us a sense of who's here. So the first question is about just a very simple one, masking. What are the best masks for children?
Yeah, so I work in the hospital, and whenever I go, they give me one of these standard surgical masks, the rectangular paper masks. These are at least 2 layers. So those are fine. You can buy these at many stores. If you want to use a fabric mask, as long as it's breathable and has at least 2 layers, then that's good. You want to make sure that it fits well so that it fits around the nose. So the paper masks that have have a little metal at the top that you can bend it and shape it to your nose, those are good. Or the fabric mask, as long as it's a good fit, you want to make sure that there's not too many gaps around. That's what's recommended in terms of masking.
Okay, next question is about vaccines. So a person asked if their child is due for the HPV vaccine, and will getting the COVID vaccine and the HPV vaccine or any of the normal, quote, series of vaccines impact effectiveness?
So initially, when there was little experience with COVID vaccines, the CDC recommended that there should be at least a 2-week separation from COVID vaccine and any other vaccine. But now we're more familiar with the vaccines. We've got more data, we've got more experience. And now it just doesn't matter. You can get that HPV or other vaccine on the same day at the same time as COVID vaccine, or you can separate it out by any interval you want.
Yeah. And how about with the upcoming flu season, Dr. Dean, any updates about flu shot and COVID vaccine?
Yeah, it's the same thing with flu shot. And I've heard some people say they'd rather have it separate. I can tell you personally, I'd rather just get everything done at the same time myself, but it's whatever your personal preference is, you can do that.
Someone asked a question about reported new side effects about heart inflammation in boys specifically. Can you please talk more about this?
Yeah, there's some really interesting data that's coming out on that. We do have an increased risk of the myocarditis or pericarditis, the inflammation of the heart, with the mRNA vaccines, both Pfizer and Moderna. It's a relatively low risk, but obviously that's scary. I can also tell you that there's a risk of getting it from getting the myocarditis from other causes, which includes getting myocarditis, for example, from getting COVID. And the CDC just today released some very interesting data on that. And what they found was that for those subjects who get COVID, that it's even higher risk of getting myocarditis compared to those who are getting vaccinated. So up to 10 times higher risk of getting myocarditis, inflammation in the heart, for somebody who gets COVID versus getting vaccinated. So if you do the risk benefit, if you run the numbers, it's much safer to be vaccinated than to be unvaccinated. And being vaccinated helps protect your child against getting myocarditis, getting inflammation of the heart.
And just to make sure we fully answer that question, that is true for children, those 16 and younger, right?
I'm sorry, that's true for children. The highest risk is in the youngest children, those 12 to 16 years of age, but it's higher in males, and it's true for all males less than 50 years of age. And there's a higher risk also for females less than 30 years of age.
Okay.
But yeah, the highest risk is the 12 to 16-year-olds.
So Dr. Lena, thank you for sharing with us your pregnancy, because definitely one of the questions is, what does it do to pregnant women? But someone also wonders if we can address the infertility question, the idea that somehow vaccines will cause infertility. Is there any actually evidence that suggests this?
No, there's no evidence to show that this vaccine or any vaccine in the past has or will cause infertility. There was some false information put out on social media and on the internet at the beginning of this that led people to believe that. But all of the studies that have looked at this have not showed any increased risk for infertility. I was obviously vaccinated before getting pregnant, as were many of my colleagues and friends. And there was some comments in the beginning about like changes in the menstrual cycle, and that has not played out either in the data. So we are not seeing that.
Okay, so a series of questions specifically about toddlers. So one is for children that are under 2. When you go to most places, boarding an airplane, they say mask required except for those who are under 2. So what do you do for a child who's under 2? And if you choose, let's say a child is under 2 is interested in masking, is that recommended?
I think it depends on their neurodevelopment. So we're not recommending it less than 2 because children need to be able to remove a mask safely, because otherwise, if they have difficulty breathing, it could be dangerous for them. They could suffocate. And so generally, we think that most kids 2 and up can wear a mask safely. If kids are less than 2 and they want to wear a mask, then I would advise that they be supervised at all times while they are masked by a parent, so that the parent can help them remove the mask in case they do have some difficulty breathing.
Another question about protecting a newborn. So this person says that they have a toddler who's in daycare and socializing with other children. So is it safe for their toddler to continue to play with other children while the newborn is there? And how can they keep that 6-month-old safe if also that 6-month-old begins to attend daycare?
Yeah, this is a tough one, right? Because we know newborns are so at risk for getting infections and getting other things, and that young toddler obviously can't be immunized and sometimes can't be masked. So we completely understand that a lot of us are working parents and need to rely on daycare. And so one thing I tell all the parents that I work with is that I think it's completely reasonable to ask your daycare if their staff has been vaccinated. If they're not comfortable sharing with you, then it's on you, right? If you want to go to a place that may be more comfortable sharing that information. But in most experiences, they are comfortable. The ratio of students to teachers is important at this. So if you're going to have 20 toddlers together, that's going to increase their risk of bringing something in from the outside, especially right now. And of course, like just paying really close attention to your infant's symptoms. So if they have any of those normal daycare symptoms like runny nose or anything like that, I would separate them from that newborn. Have one of the parents kind of isolate, at least until you get a negative COVID test or RSV or any of those infections that are at risk for being severe in young babies. And lots of hand washing, maybe not kisses on the face. So all of that stuff just to make sure to keep them safe. But I am not telling anyone to pull their kids from daycare if they need it to continue to work.
So Dr. Dean and Dr. Lena, the data that you presented was that school was actually a safer place for kids to be than at home. However, people have questions about if their child falls into one of these categories of high risk, specifically a child with asthma, a child with IgA cognition, or also a child with trisomy 21. So is school the safest space for a child with high risk factors?
Yeah, everybody's going to have different risk tolerance for that. And so certainly a child with asthma is at higher risk for more severe disease. And so I would make sure to take all the precautions that we've talked about. So you'd want to be in a school that the adults who are eligible for vaccination, that they do have a high vaccination rate, that routine masking is followed. Children who have mild asthma, for example, they're not on daily medication, they're not considered higher risk for more severe disease. So I really wouldn't be too concerned about that. IgA deficiency, as far as I'm aware, is not a risk factor for severe disease. And then trisomy 21 or Down syndrome, yeah, that is a risk factor. They do have weakened immune systems, but everybody's going to have to make these compromises in terms of realizing the value of in-person learning and how valuable that is for the child and the family, and balance that with the risks of infection. But all these risks can be mitigated with vaccinating those who are eligible and then routine masking.
So now a series of questions about what happens if a child should unfortunately come down with COVID, right, which is increasingly occurring as you stated. So the first one is about long COVID. Are we seeing instances of long COVID in kids 0 to 3 years old, or just kids 16 and under in general?
Yeah, I've seen that, but there's very little data, and there's very little good data about how frequent this is. So we don't know that if kids get this more or less frequently than adults. We don't know the specific risk factors for development of long COVID. We have some idea about some ideas for treating it, but not great ideas for treating it. So really, when it comes to long COVID, we've got more questions than answers. And really, I think to me, the take-home message about long COVID is it's just one more reason to try to protect your child from getting COVID.
Yeah, and one other thing that I want to add to that, which is not long COVID, but is necessary for some follow-up after your child has COVID, is that we do know, like Dr. Dean mentioned, that it can affect the heart. And even if your kid doesn't go to the hospital with symptoms of myocarditis, there are some criteria for returning to sports after having it. So this will most likely be in your older kids. And so if your child does get COVID, there are some strict criteria that we as pediatricians follow about when they might need some extra workup, like including an EKG or a rhythm analysis before being cleared to return to sports. So I would, if your child is of that age and does participate in like competitive sports or high school sports and has had COVID, just check in with your pediatrician before they go back to play to make sure that they're ready to return.
So then this question is about morbidity. So what is the rate of morbidity for pediatric patients? And does it compare specifically to the seasonal flu? Is it higher?
Yeah, so it is higher. Both the morbidity and the mortality are higher for COVID compared to influenza. If you take a look, for example, at last influenza season, we had a lot of children distance learning. We had a lot of masking. We had some vaccination. And because of that, what we found is we had very little cases of influenza. At UC Davis Medical Center, we had no hospital admissions at all for influenza. And in the US, one child has been reported to die in the last influenza season. A normal year, we usually have 100 or more kids die from influenza. And compare that with hundreds of children, even with the same mitigating factor, hundreds of children died from COVID during that period. So we know that COVID is much more serious than influenza and poses a much bigger risk than influenza.
So more questions related to if you get COVID, what are the long-term impacts on children? So there are also reports that in other countries, there are some other illnesses that are occurring with COVID. So what's causing children to get sick in other countries, and could that happen here?
Yeah, I think that they're getting the same things that they have here. I think the odd thing is the seasonality. So because we've messed up the regular seasonality of respiratory viruses with all the different social things that we've done, that we're starting to see winter viruses circulate in the summer. And so it's really kind of odd. And then we do get co-infections. So you don't just have to have COVID, if you get COVID, it's also a risk factor for getting another infection like respiratory syncytial virus or RSV at the same time, or even a bacterial co-infection like with like the bacteria that causes pneumonia, pneumococcus, or strep infections. So we've certainly seen that also.
Okay. And then this next question also relates to RSV in that what are the health risks for children for different SARS COVID variants, and how do they compare to other RSV issues or other viruses?
So RSV can often commonly causes wheezing in young children, and then they sometimes need to be admitted to the hospital for wheezing or bronchiolitis. In terms of the different variants, we have some pretty good data in adults that the Delta variant causes about twice as many hospital admissions in adults compared to previous variants, such as the Alpha variant, which was first recognized in the UK, and higher ICU admissions also. We've got little data in children, though, so I'm not sure that that applies also to children.
Okay. And so unfortunately, someone has just stated that their 18-month-old and their 6-year-old have just tested positive today. So what should they do? And they're exhibiting symptoms.
Yeah, well, we're really sorry to hear that. And, and you're not alone. There are a lot of parents going through similar things right now. So the first thing is that, this is a viral infection. And for the majority of kids, they do fine at home with supportive care. So what that means is they may have really high fevers, they may have some cough, runny nose, sore throat, vomiting, diarrhea. And so what that means is really encourage fluids at home, give them Tylenol and Motrin, alternating, make sure you get the appropriate dose for their weight to make sure you keep that fever down and make them feel better. Monitor their respiratory status. So does it look like they're working hard to breathe? Are their little nostrils flaring out? Are they tugging here? Are they having any tugging under their ribs? If they are having that, then you can still come in and see your pediatrician. We are, you want to call beforehand, let them know that you tested positive, but we're masking and gowning up and seeing kids. So we can check to make sure the oxygen level is still okay. And then if you are really concerned or your parent vibes are going off, like they're not drinking well, they're having less than one wet diaper every 8 hours, they're looking like they're working really hard to breathe, then you want to go into the emergency room. And here at UC Davis, there is always a pediatric emergency medicine physician available 24/7, and they can monitor and make sure that your kid's okay. So definitely do not hesitate to reach out to come and get care if you feel like you need it. But a lot of times just checking in with your pediatrician, either through a video visit or a phone visit, to kind of help walk you through what looks normal. They can lay eyes on your kid even over the video, can be reassuring to some parents.
Thank you for that, Dr. Lena. And indeed, part of the thing about the Healthy Davis Together project is that no one is alone in the Davis community. There are tremendous resources and healthcare available. So, and we just wish you and your children the very best. And then with a follow-up question is that once a child recovers from COVID, can they get it again?
Yeah, people can certainly get COVID twice. The risk of reinfection is very low in the 90 days after infection. There's good immunity during that time, but it wears off over time. And so for older children and adults, it's recommended that even if they've had COVID, that they should get vaccinated because that'll decrease the risk of reinfection.
So the next series of questions all focus on school, which is what many people here are interested in and what's safe to do or not to do at school. So the first question comes with about a lot of spacing issues in schools. So what are your thoughts about elementary school students' desks being placed in groups of 4 in the classroom?
Go ahead.
Oh, I think it's fine. The cohorting helps the contact tracing. So if somebody does get exposed, then it really limits the number of contacts that they have. And so that's why that strategy is sometimes used. Now, every school is going to be different in terms of class size and teacher to student ratio, and then the physical capabilities of that. But I think that's a reasonable strategy to limit contact tracing.
So this next, I'll bundle this up into one question, has to do with the fact that the data that you presented about what schools were like was pre-Delta, right? And whether or not Delta has changed things. So the question is school really a safe space without vaccinations being available? And what are some things that parents can tell their kids who are really anxious about going back to school? And then I'll just add on to that, is that data that you presented pre-Delta, is it going to change?
Yeah, well, I don't think that we know for sure if it's going to change. My suspicion is that it is just based on exposures and number of kids testing positive, is that it will change. But that doesn't mean that I don't think that kids should be back in school. I do. I do think that by following these algorithms, by being extra cautious in terms of exposure and testing and all of that, that we can keep kids in school safely, and masking, of course. And so, it's very normal for kids to feel anxious during this time. They've been out for a year or longer. They are, following all of these new workflows. They're nervous if they have like a little runny nose or a sore throat. Should they tell somebody? Should they not? And so I think just really walking through and trying to, as best you can, prepare your child for what the school is going to look like, and never trying not to get upset when these things happen. Although, of course, I know it's infuriating when you're getting an exposure notification and you have to take time off of work every other week. Trying not to make it seem like it's the student's fault, your child's fault, because of course this is totally out of their control. And for testing, just trying to make it seem like this is something that we're doing to make sure everybody's safe and to keep you all in school safely, and just trying to make the process as normal as possible, despite how not normal it is right now. So play dates with friends, masked is great. Kids tend to do a really good job masking, and doing their homework with them and art projects with them, and debriefing about their day and talking about what was weird about it, what was scary or new. So just allowing them to process all of these new emotions.
So Dr. Lena and Dr. Dean, you presented a sample decision tree for a school, but several panelists have said that this is not what their school is using. So here's a very specific one. So a particular school has said that students must be masked and must be 3 feet apart when feasible. So this particular school defines close contact as someone within 3 feet, and that they will only notify close contacts and not everyone in the entire elementary school classroom. So should this parent be worried about their 7-year-old being in that particular classroom setting?
Let me just, I'll jump in and talk about the 3 versus 6 feet. That's relatively arbitrary. So in the US, we've used 6 feet. In the European Union, they've generally used 1.5 meters, which is about 4.5 feet. And we do have, pre-Delta at least, we had experience that children who are masked, if they distanced 3 feet in a classroom, that the transmission rates were exactly the same as if they distanced for 6 feet. So I'm not really worried about the 3 versus the 6 feet. I'm confident that that's okay, but I'll let Dr. Lena address the rest of the question.
Well, I will say that there are, so I'm not sure if you're in public or private or what, but most school boards now have a dashboard that you can follow. So I at least know of them for the Davis Joint Unified School District and the Sacramento Joint Unified School District, where they are frequently updating data about number of cases that test positive, number of people that are in quarantine. And so if you just Google COVID dashboard, Davis Joint Unified or Sacramento Unified, you should be able to find your child's school. And if you're in a private school, you would have to ask if they have something similar. And so that may be a good way for you to sort of ease your worries about if there seems to be a lot of cases at your school. Of course, this is an ongoing thing. And so if you are active on your school board or your parent, your PTA, you can say, I would really feel more comfortable as a parent if if I was notified of any exposure or any kid tested positive in the classroom. And maybe they can give that decision to all of the parents, like, hey, do you want to just be notified when it's within 3 feet, or would you rather be notified if there's any exposure at all? And so I think that this is an ongoing process and something that parents are going to have to work closely with school administration about, at least in the private school setting, maybe more so than the public, who may be using more of those algorithms.
So here's another decision tree question, is that the school decision tree doesn't tell us what to do about siblings. So this person has a question that their daughter's table partner, the child who sits next to their daughter at school, tested positive. And the decision tree says that she can go back to school with a negative test. So does her sister, the sibling at home, and the parent also need to do anything?
I would keep, as long as sister remains completely asymptomatic and the direct exposure has tested negative, I think that it's okay not to test the sister. What do you think, Dr. Dean?
Yeah, I mean, the tricky part, this is tricky, because the tricky part is obviously if they test negative, then you don't have to worry about it, right? It was a false alarm. But you don't know that until they test negative. So during that period of time, they could be infectious and they could expose the sibling. So I guess it would depend on if it's feasible to isolate or quarantine the siblings, and then how high risk was the exposure or not, because what you could get is then this whole chain of transmission within the family. So I just think that depends. If your kids are getting exposed like constantly, I don't know. I mean, I can imagine that you'd eventually get fatigued with it all, and really it wouldn't be feasible to do any kind of isolation or quarantine.
Mm-hmm.
Okay. So questions about outdoors. So should kids be masked outdoors for outdoors and outdoor activities?
Well, 90% of transmission takes place indoors. So anything outdoors is much safer because the virus is diluted by the huge volume of air there is outdoors. However, if children are in a crowded situation where they're not able to social distance, then I do recommend masking. If they are able to social distance outdoor, then they don't have to. I can tell you for myself, the most crowded situation that I'm in when I'm outdoors is when I go to the farmer's market, and not everybody's distancing at the farmer's market, that's for sure. And so I always wear a mask in that situation. So it just depends on the situation.
Okay. And is that the case even for children who are too young to be vaccinated? Is it okay for those kids to be participating in sports and extracurricular activities?
I think it depends on the sport. So, obviously if it's something like singles tennis or golf, they're going to be able to social distance really well. But, if it's something else where they're in really close contact, then, they should mask as long as it's safe to do so.
Okay, and here's another question that has to do with something that many of us did at the beginning of the pandemic, which is wiping down objects. So for things at school, like books that are coming back, Chromebooks, changing your clothes when they come back, should those activities also be done?
The primary route of transmission is via the respiratory route. So the number one thing you can do is get vaccinated. The second most important thing is masking. The third most important thing is the quarantining and doing symptom screening and all that. Way down on the list is getting it by contact. So there's very little evidence of getting it by contact, but sanitizing things, cleaning, washing your hands, that prevents a lot of other infections like norovirus or staph infections. So that's still a good thing to do, but it's really not going to have much of an effect in terms of COVID.
And then even though, again, stats have shown that schools are relatively safe spaces, what, in your opinion, are conditions or circumstances or case rates that indicate that it's no longer safe for children to attend in-person school?
For me, I think I agree with Dr. Lena. If you're having an outbreak in school, if we're starting to see high rates of transmission related to school, then that's a game changer. And then we're going to have to rethink things. But right now, what we're seeing is that the mitigating factors that are in place are working very well. Some people may have seen in the news late last week about the outbreak that occurred in a school in Marin County, where a teacher transmitted to children. we're seeing very little child-to-child transmission. And the teacher that transmitted to the children, the teacher was unvaccinated and they took off their mask because when they were reading aloud to make sure that the children understood them. So that's going to result in transmission. If people do have masks in place, there are ways to make sure that you can articulate and children can hear you when you are wearing a mask. And if teachers are more vaccinated, then that's going to decrease risk of transmission. So we're still seeing that schools are safe places to be.
Okay, and this is probably a good thought question that someone asked. If you can talk generally about patterns that you're seeing in terms of places where there are outbreaks across the country. What are the factors that contribute to outbreaks?
It seems so far like schools that don't enforce universal masking. And so we know that is an effective measure, just like we've been talking about. Those are having more outbreaks, as well as teachers that are unvaccinated. Dr. Dean, any other big ones?
Yeah, the other thing is that teachers who don't follow the rules. And so or the guidelines. So what we found is that teachers who, for example, they take off their masks and they have lunch together and they're not social distance, that's going to lead to rates of transmission. So in almost every case when there's been transmission at a school setting, there's been a reason for it, that the teachers or the children have not been following the usual mitigating factors that we've all talked about.
Okay. Well, speaking of mitigating factors, someone writes from the state of Florida, where this person says that their school, there are no mask mandates. And so their children go to school wearing masks, but the teachers and the other students aren't masked. So are these person's kids still protected, and what more can they do?
Well, they're partially protected. So wearing a mask does two things. If you have COVID, even if you're asymptomatic, you can transmit to others. If you're wearing a mask, it decreases transmission to others. And if you're wearing a mask and don't have COVID, then it decreases the risk to you, the wearer of the mask. So the safest thing to do is for everybody to be wearing a mask, whether they're vaccinated, whether they're unvaccinated, whether they're symptomatic or not. The safest thing for driving is to not do drunk driving. And it's also great if there aren't other drunk drivers on the road, even if you're sober. So, and you want to have airbags and you want to have seat belts. So you want to have all these different layers of protection in place. So that's why we are recommending vaccination plus masking plus symptom screening. That makes it safest. But, it's an increased risk if the adults and other children in school aren't masking there, then your children are at increased risk for transmission to them.
And of course, there's also the concern of them feeling isolated and be like they're the only ones that are having to mask. And so it sounds like you're doing an amazing job and of just telling them why they're doing it, to praise them frequently for protecting other people in their classroom and their community. And hopefully you have a little cohort of parents and friends that can support the kids for doing that, because it's not easy being the only kid masked in a classroom, for sure.
So someone asked, though, cases of children testing positive for COVID are increasing. How high is the risk of serious illness or death for children under 12 relative to the general population? So you talked about cases in children. This person wonders how they should be thinking about worst case scenarios in terms of the statistics.
Well, the worst case scenario, unfortunately, is children can be hospitalized. They can end up in the ICU. They can be on ventilators, and children can die from COVID. But the risk of children having serious illness, more severe illness, is lower than adults. And there's a couple reasons for that. One is they have a lower concentration of the receptor, the ACE2 receptor that the virus binds to. So they're less likely to get infected, less likely to get severe infection. And children are generally healthy than adults. So adults, as you age, of course, you collect all these comorbidities, hypertension, kidney problems, other things, whereas children are generally healthy. So they have less risk factors for severe disease.
Okay, so there are more questions about school, but I do want to ask one about the vaccine. And someone has said, what about any potential for long-term effects of the vaccine on children? And how do we know that down the road there won't be any concerns?
Yeah, go ahead. You're the vaccine expert.
So vaccines have been around for more than 200 years. We've been using them. So we do have a lot of experience. And out of all human history with using vaccines, the longest term side effect has occurred 5 weeks after vaccination. So I'm confident that with more than 370 million doses administered in the US, more than 2 billion doses administered worldwide, that we're not going to have any long-term effects from these vaccines because we haven't seen them with any other vaccine, and we've got robust safety experience for that period of time.
So let's go back to questions about school activities. So what are the current recommendations in light of the Delta variant for activities like band, choir, really cardiovascular exercises where people are emitting a lot, especially when, let's say, masking or social distancing may not be available?
I will just say that those activities are so beneficial for so many other things, right? And one of the things that we've all talked about is how this has impacted kids in negative ways. So there are ways to do it safely, I think. I think that, of course, just like that sort of decision tree said, if there's any exposure, if there's any symptoms, of course, you're not going to participate. But I think it can be done safely if there is distancing involved. So if your child has band practice, hoping that they do keep that 6 feet of distance. Maybe they're practicing outside now. I know I've seen that at my local high school. All things that can be done to decrease transmission, but still allow these kids to participate in these really beneficial activities. And then, of course, it's an individual decision from the parent standpoint if they do not feel comfortable. I also think that's totally reasonable.
And then speaking of the decision tree, several people have asked, where does that decision tree come from? Is it a Yolo County decision tree? Is it California or a particular school?
This was from Sacramento County, and I can share it. I'll email it to the panelists, but I believe that they're using similar ones, at least in some of the private schools out here as well, that I've seen. I haven't seen as many from Davis, so I'm not sure exactly what they're using for Davis Unified.
So we are about 2 minutes over time, but still 2/3 of the people are still here. So can we ask just a couple of the more questions? Okay. So one has to do with this other epidemic that's occurring right now of wildfires in the area. So some schools have said that on days with poor air quality, students will be able to be unmasked during recess and lunch, even though doors and windows will be closed. So does this increase the risk of COVID transmission?
Yeah, I mean, if the kids are unmasked, it's going to increase the risk of transmission. But my recommendation would be if the air quality is so bad, they shouldn't be outside, right? They should be inside, and then they should wear masks. And then in terms of doing things like having lunch, hopefully what they can do is they can stagger lunch times so that children can eat in a distanced manner when of course, they can't eat if they have their masks on. But to stagger the lunch time so that they're not all crowded all at the same time with their masks off.
So another question about masks, particularly with the poor air quality, is that the N95 masks, would you recommend those for young elementary school age children, or are those only for adults?
You can get small N95 masks. We're really only recommending those N95 masks for children who have a significantly weakened immune system that need extra protection. So children with cancer, for example, that they should have that added protection of getting an N95 mask versus the standard surgical or fabric masks.
So let's just end perhaps with just 2 more questions about this. So this is very Davis specific in that UC Davis offers the spit test for employees. And is that accurate for children?
Yeah, the spit test has been studied in children. They've done several quality control studies on that. It's very accurate. It's more accurate than the antigen testing. And I had my first spit test a couple of weeks ago. I was visiting my 98-year-old mother-in-law. So my wife said, we both need to test. That was kind of fun doing it. I have to say that spit test was really painless and easy to do. And it's a highly accurate test. It's a PCR assay, and so it's similar to doing the deep nasal swab and much less painless, much less painful.
I will say that those are designed, and as is the Healthy Davis Together, is designed to be asymptomatic screening. And so I have had some parents and people ask if their kid was exposed, should they still be utilizing those things? And I think that answer would be not ideally no, because potentially you could be exposing those other asymptomatic people that are just doing it to like gather data about the community and doing things like Dr. Dean, or he was not exposed, but he was going to see his grandmother. So if you do have a true exposure or you have any symptoms, then you should still be not utilizing those asymptomatic screening or the Healthy Davis Together asymptomatic screening.
And there's another question about siblings, and that is, my sister got COVID and my family is vaccinated. Should I stay at home or can I go to school even though I don't show any symptoms?
You know, the recommendation for those who are vaccinated is if they are exposed, that they can continue to go to school, but they need to do symptom screening is the important part. So if they develop any signs or symptoms, then they should get tested after significant exposure.
I don't know if that's true based on the decision tree, Dr. Dean.
Oh, I don't know if that's true.
For schools. So at least based on this, because your sister is now an ongoing exposure in the home, and even though you are vaccinated, there is the risk for potential transmission of the Delta variant, then what they would recommend is at least a home isolation, I believe, for at least that 7-day period, quarantine for 10 days at home with her. That is my understanding, not knowing your exact situation. But the schools, just because they're really trying to decrease transmission and exposure, are being a little bit stricter about in-home exposures that continue to be ongoing.
And then just the very last one is, what is the status of breakthrough cases in terms of pregnant women? Is it any different than those who are not pregnant?
I don't think we have that data yet, unfortunately, but it does seem to be, again, just like we're seeing with the Delta, the severe infections that are hospitalized, greater than 90% of people that are admitted to the hospital or in the ICU or intubated are unvaccinated. And that seems to hold true with pregnancy, at least that I've heard of. But I think that we're still going to learn more about breakthrough infections. And I definitely think it's more possible now.
Yeah, I don't have any specific data on pregnancy, but I can tell you that in terms of those who are getting COVID now, that the rate is 16 times higher in unvaccinated individuals versus vaccinated individuals. So your major risk factor for getting hospitalized and being in the ICU is being unvaccinated.
Thank you so much, Dr. Dean and Dr. Lena. Continue, you've already had a very long day. For those of you who come in, I just want to say that we've recorded this. You'll get the recording of this, and we're going to continue the Parenting During the Pandemic series. Unfortunately, it does not seem like this will go away soon, so we'll continue up-to-date information. If any questions, please do send them our way. And thank you, and please keep yourself, your families, and your children safe. So thank you.